I always say to patients that a previous patient said to me that they would describe a medication review as an MOT of their medicines, and I think that's a fantastic description. It's the chance to make sure that your drugs are as best as they can be for you as an individual. So Linda, who I first met about 3 months ago, is a 64-year-old lady from Fife. She's got multiple medical conditions that required quite sort of complex medication when I first met her, and those include kind of chronic pain, high blood pressure, a skin condition called acne rosacea, and painful swollen ankles, and a history of low mood and anxiety.
Well, when I first got the phone call, I thought, what's going on? And then Fiona explained things a little bit, what we would be doing on the phone, and I went, yes, I'd love to come in.
She herself was keen to understand whether they were all still required, as she'd been stable on them without change for several years. She was noticeably still sore despite multiple strong painkillers, and also she felt that her skin condition was not as well controlled as it had been previously. On a kind of positive note, our mood was good, so she was wondering whether there was still an ongoing need for her antidepressant medication, and her blood pressure was well controlled, possibly offering us the opportunity to look at the number of blood pressure pills and the dosage of them that she was taking. I think kind of slowly over the course of 3 appointments we've made some quite significant and positive changes to Linda's medicines, and we've reduced the complexity of the drugs that she has to take on a daily basis, and I think also improved her quality of life.
I couldn't go to a shop without my husband being there. I would never have been able to come in here like this without him being there to help me, because I couldn't have walked as much as what I do. I would go to bed at night and it ends up I could sleep for 2 hours, and then I was up for an hour, sleep for 2 hours, and I was like that all day and all night.
When I met Linda, she was on 11 regular repeat items, and now she's on 6. So we've almost halved the number of regular tablets that she takes on a daily basis. We identified that she was on 3 similar types of painkillers, all of which were relatively strong, and that she felt quite sleepy and drowsy on the combination, but still actually remained in quite a lot of pain. So between us, we chose to focus on 2 painkillers and to concentrate on more regular dosing, and it's meant that now Linda's pain has improved. She feels less drowsy and sluggish and constipated, and her pain is better. She's also off a particular medicine called nefapam, which is quite strongly associated with confusion and falls and drowsiness in elderly patients, so we're delighted that we're able to manage things without that particular tablet.
This lifestyle now that, wow, this is great, I could get out to the shops, and I'm starting to take more control of me instead of the tablets taking control of me. Now I could understand why I've been put on that medication. You're getting to understand what each medication is doing to your system. As my grandkids and that says, now I live for my kids. They've got a better granny now, so that makes a big impact in my life. Every surgery should have this, and it ends up every patient should be able to get a chance to go to them.
Linda's story really kind of highlights to me that medication review can't be a one-off manoeuvre. It has to be an ongoing review process that you do very much jointly with the patient as a kind of equal partner. And when you get positive feedback from a patient that your input has helped them to understand their medicines more, and that we've managed jointly to simplify our drugs and reduce our risk of side effects in the long term and improve our quality of life, I don't think I could ask for anything more than that.